Hannah, question 1. A 36-year-old man develops an intensely pruritic rash after hiking through the woods. On exam, he has linear vesicular lesions on his forearms. Which of the following best describes the immune mechanism involved? A. IgE-mediated mast cell degranulation. B. Immune complex deposition and complement activation. C. CD8 plus T-cell mediated cytotoxicity. D. IgG-mediated cell destruction. E. Natural killer NK cell activation by antibody-coated targets. C. CD8 T-cell mediated cytotoxicity, contact dermatitis, e.g., poison ivy, is a classic type 4 hypersensitivity reaction involving CD8 plus T cells and inflammatory CD4 plus cytokine release. Incorrect options: A. Type 1 hypersensitivity, e.g. anaphylaxis. B. Type 3 hypersensitivity, e.g. lupus. D. Type 2 hypersensitivity, e.g. autoimmune hemolysis. E. Antibody-dependent cytotoxicity equals type 2. Question 2. A patient develops a widespread skin eruption, fever, and eosinophilia several weeks after starting a new anti-epileptic medication. What is the most likely diagnosis? A. Arthus reaction. C. Dress syndrome. D. Stevens-Johnson syndrome. E. Fixed drug eruption. Correct answer C. Dress syndrome, drug reaction with eosinophilia and systemic symptoms, DRESS, is a type 4 hypersensitivity reaction involving T cells, cytokine release, and systemic inflammation. Incorrect options: A. Arthus localized type 3, B. Anaphylaxis type 1, D. SJS is a severe mucocutaneous reaction, can overlap, but DRESS has eosinophilia and internal organ involvement. E. Fixed drug eruption is less systemic and not classically type 4. Question 3. Which of the following immune tests assesses T-cell mediated immunity and is commonly used for latent Mycobacterium tuberculosis infection? A. ELISA for IgB patch test. C. Direct Coombs test. D. PPD skin test. Correct answer D. PPD skin test. The tuberculin skin test, PPD, is a classic example of type 4 delayed hypersensitivity where memory T cells mount a response 48-72 hours later. Incorrect options: A. Ig equals type 1 hypersensitivity. B. Patch test another test for type 4 but not TB specific. C. Coombs type 2. E. ANA equals autoimmune testing, SLE, etc. Which of the following best explains why graft versus host disease, GVHD, occurs following bone marrow transplantation? A. Host T cells attack donor tissues. B. Host B cells produce antibodies against graft HLA antigens. C. Donor T cells recognize host antigens as foreign and mount a cytotoxic response. D. Circulating immune complexes activate neutrophils. E. Mast cells degranulate in response to donor proteins. Correct answer: donor T cells recognize host antigens as foreign and mount a cytotoxic response. In GVHD, donor T cells from the graft attack the recipient's tissues. This is a type 4 hypersensitivity reaction. Incorrect options: A. Reverse of what happens in GVHD. B. Describes a type 2 or type 3 process. D. Type 3 hypersensitivity, immune complexes. E. Type 1 hypersensitivity, IgE mast cell mediated.